All right, so you're either enjoying the springtime fun or you're suffering with seasonal allergies. Don't let spring allergy symptoms prevent you from participating in activities you enjoy. In today's To Your Wellbeing, everything you need to know about allergies. Dr. Joel Gallagher with Allergy and Asthma of NC is our expert today. So first and foremost, let's talk about this because everybody, especially with COVID and all that kind of jazz, how can someone tell the difference between allergy symptoms and the other sicknesses?
That's a really good question. We had a hard time with that early on in the pandemic. Allergies tend to be more itching. Think itchy eyes, itchy nose. That's because of a chemical called histamine. Whereas if you have a virus or a bacteria, you have a lot more, well, number one, fever. Fever is never associated with allergies. You'll also have just 1 to 2 weeks of symptoms, whereas allergies can continue for the whole season, depending on what you're allergic to.
All right, let's kind of maybe go step by step. What's common and what's different in both seasonal allergies and like the common cold?
Okay, so you can have runny nose with both the seasonal allergies and the common cold. You can also have a lot of sneezing and nasal congestion. With the common cold and other viral illnesses, you'll have more fever and generalized malaise or fatigue. And then, of course, you can also have the anosmia, which is the medical term for not being able to smell or taste. So that's what you see with COVID-19. You can have cough with both of them because of postnasal drip and stuff dripping down your throat. But when you have more of the itching, more of the itchy eyes, itchy nose, you want to think more allergies.
Okay, so this is very common. Someone is sneezing or they have nasal congestion. If it's clear, is it a seasonal allergy versus like an infection where sometimes you see like green mucus and things like that?
That's a really good question. So early on, even viruses and colds can be clear mucus. But if it goes on for a long period of time, it becomes more green, yellow. You want to think more of an infection.
Okay.
And also, of course, the allergies can continue for several weeks or even months at a time.
Right, mine just don't ever seem to go away. All right, what should people do to help relieve their allergy symptoms?
So I think one good way to start is just to take an over-the-counter antihistamine. There are a number of really good ones on the market that you can just run into Walgreens and get. Zyrtec is one I like a lot. Allegra is really good, especially if you tend to become sleepy with antihistamines. That one causes the least amount of sleepiness. Benadryl is always good too, but that one you have to dose pretty frequently and you become a little bit sleepy from that one too. So if that relieves it right away, I think, bam, you've got your diagnosis. So
right.
It's probably allergies.
A lot of people like to use like a saline nose spray or they like to use a neti pot. So do you suggest those?
Those are really good because they help get rid of all the pollens and the environmental allergens from your nose where they're interacting with your immune cells and causing all the symptoms. The problem with those is that you have to use them, 2 to 3 times a day to get the full effect. And you want to really be careful with those because a lot of people just like to run to the tap and use tap water with those, but you can get some brain-eating amoebas with that. Very rare, but it's important to use distilled water if you're doing your own neti potting.
What? Okay, I had not heard that before. So do not put the neti pot underneath the tap and get the water out of there. Make sure you use that distilled water.
Exactly.
Okay.
How about one more thing to be worried about?
Yeah, one more thing. That's right. All right. How about this? Because I have this, the watery eyes. Like sometimes I can't even put on makeup and stuff like that for a couple of hours in the morning. So what can we do for watery eyes related to seasonal allergies?
So again, there's some really good ones over the counter. I really like Zatador because it uses a couple of different medications that target that itchy watery eyes. And another one that just went generic is called Pataday. And that's a fantastic medication too. So go grab some of those.
Okay, and say those two again in case people missed it.
Yes, Zatador with a Z and then Pataday.
Okay, all right. And what steps can we take to like decrease the triggers or the exposure to the pollen besides, not ever going outside?
I mean, living in a bubble is probably the best thing to do, but not practical. We've done enough of that here with COVID. But what you want to do is definitely close those windows. I know we all want that fresh air in, but that has a lot of pollen in it, especially early in the morning. All those windy days bring all sorts of pollen in. Using a HEPA filter, especially in the bedroom where we spend a lot of time sleeping, can help decrease the dander from pets and even the pollens from outdoors. Using the air conditioner Also, changing your clothes when you come in from like a hike or spending time outdoors gardening or doing whatever you do outside. That way you can leave the pollen in the washing machine and then put on new clothes that are pollen free.
Gotcha. So here we want to ask about this. Does age affect how susceptible you are to outdoor allergies?
It does, actually. You really don't develop environmental allergies until about age 3 or 4. And that's because you have to experience the pollens several times before your immune system recognizes them as, foreign agents. So usually kids about 3 or 4 will start to experience those environmental allergies. And they tend to get worse into your 20s and 30s and then tend to get better after that.
Okay, so I was about to ask, is there an age when allergies peak and then will go away that we can look forward to that?
Yes, so after your mid-30s to early 40s, they'll start to get a little bit better. But that being said, I still see patients who are well above that, and they have allergy symptoms.
And they have allergies, so it's not like that's going to go away.
No.
All right, how about this? Are allergies hereditary?
They are hereditary. There are a number of genes or genetic codings that make you more susceptible to allergies, and they do tend to run in families. So oftentimes we see entire families in our practice who have allergies.
And with that, is that like allergies to pollen or like allergies to food, or it can be anything?
Usually the environmental allergies have a stronger genetic component. Food allergy is less so, but definitely environmental allergies as well as asthma and eczema.
Okay. Now, how long can we anticipate the seasonal allergies being so bad? And I don't know if that changes depending on where you live.
It does change depending on where you live, and it depends on what you're allergic to. Some people are lucky enough to just be allergic to tree pollen, for instance, which is sky high right now, but by the time May rolls around, it will be a lot lower. But most people we see in our clinic are sensitized to tree pollens, which peak in the early spring, and then grass and weeds, which get worse in the summer, and ragweed, which starts flaring in August and continues to the first good frost. So depending on what you're allergic to, you might be having issues year round.
Yay! Okay. All right. So at what point should someone consider allergy testing and not just doing the over-the-counter thing?
Well, I think if the over-the-counter stuff is working, I didn't even mention the nose sprays earlier, but there's Flonase and Nasacort and some other good options over the counter. If they stop working, I would probably come and see an allergist so you can maybe pinpoint more of what you're allergic to. And if you want to take that next step and do allergen immunotherapy or allergy shots, you'll need to see an allergist to do that.
And what's the upside to that? Do they get gone easier?
It's a curative process. It's kind of a long time commitment, but we give injections of what you're allergic to retrain your immune system. That's how I describe it to patients, so that you don't have all the mucus production, the itchy eyes, the sneezing from all of your allergies.
Okay, so a cure process, but it takes a process, so it is a couple of years.
It's a process, yes.
Okay, so with COVID still around, not wanting to confuse seasonal allergy symptoms with COVID, we wanted to go over this again. What symptoms may be related to COVID and not to allergies?
So COVID, we've learned, can do just about anything, but between allergic rhinitis and COVID, they both cause a lot of runny nose and congestion and sneezing. But with COVID-19, you'll often have the fever, which again is never allergies, and the inability to smell. So think of that if you're worried about COVID. And of course, take rapid tests since they're more available now.
I was curious with the stuff that you take over the counter, like the Zyrtec and that kind of thing. Should you take it during the day? Should you take it at night? Are there pros and cons of doing both?
Yeah, so most people might have some sedative or sleepy side effects to it. So I usually recommend starting at night to see how they tolerate it. And often I recommend doing it on the weekend when you don't necessarily have to go to work in case it does cause grogginess.
Okay, and if one doesn't work for you, should you just try another? And how long should you try it? Like a week and a half?
You should know within a week if it's working or not. Some people notice that it stops working after a month or so, and I just recommend changing to a different product for another couple of months. So a lot of our patients' medicine cabinets have multiple antihistamines, and they just change it according to the month of the year. So,
because your body gets used to it and then it cycles it out. All right, thank you so much for joining us. We appreciate it. If you missed,
for having me.
Yes, absolutely. If you missed any of this information, you can find it on our website, WFMYnews2.com.